varicose veins, the underlying problem with varicose veins is valves that don't work. So we're all born with one-way valves that move blood against gravity back up to the heart. And when those valves give way for a variety of reasons, then the pressure in the veins goes up. And when the pressure on the veins goes up, that's called venous hypertension. And venous hypertension leads to a number of different problems within the legs. And varicose veins is just one of them. But unfortunately, there are many, many other problems. So swelling, aching and swelling, so aching and pain in the legs, eventually itching, skin changes, and if left completely untreated, unfortunately, even ulceration later in life. Yes, so particularly if veins are not treated, then of course the venous hypertension is there for a lot longer. And the longer that the venous hypertension is there for, the more damage it can do. So patients tend to progress along a number of different changes. We talked a little bit about the skin changes. The symptoms also worsen, the physical appearance of the veins worsen, and then eventually patients can develop skin changes, and in particular, red, itchy skin, which is called varicose eczema, slightly darker pigmented skin called venous hyperpigmentation, and then eventually thin, brittle skin that can lead to ulceration. We talked a little bit about the underlying problem that causes varicose veins, and so the diagnosis, first of all, is a clinical diagnosis. You need to speak to your vein specialist, your vascular specialist, and they will look at you and make a clinical diagnosis. We then move to a radiological diagnosis. So we need imaging, and the easiest way to do that is a very simple, painless ultrasound. And what that ultrasound will look for is evidence that the veins and the valves in those veins are not working, and that there's blood that's flowing up and back down again. That's called venous incompetence. So there's a variety of treatments available on the market, and as always, treatments should be tailored to the patient, the symptoms, and their specific circumstances. But broadly speaking, you can divide vein treatment into what I call open or traditional techniques. And here there might be a surgical procedure under general anesthetic, and stripping, which is something that we thankfully rarely do these days. The majority of treatments that we do, particularly at the UK Vein Clinic, involves minimally invasive techniques. Now, the minimally invasive techniques have developed in order to be more convenient for the patient, so there's no general anesthetic. It's all done under local anesthetic in a fairly painless procedure. You walk in, you walk out. It is done via minimally invasive or keyhole techniques, which involves a very tiny little cut, if at all. And that means that the recovery time and the return to work is a lot quicker. And I'm sure that your listeners, much like me, are very concerned, particularly in the current economic circumstances, of getting back to work quicker. And we find that that suits patients' lifestyles a lot better as well. Well, the answer to that is that at the moment, I would say no. There's a lot of different treatments that have been tried and are available. The evidence seems to show that actually they don't work. What you can do is you can try and manage the symptoms of varicose veins until you've had treatment. And some patients, unfortunately, are not suitable for treatment, so that we have to manage those symptoms with non-surgical techniques. So those sorts of things are things such as lifestyle modifications. So varicose veins and vein problems tend to get worse when you're standing. So trying to sit and elevate a lot more. Graduated compression stockings, and these are special types of stockings which whereby the pressure in the stocking changes as you move up the leg, and in this way it pushes blood up the leg, again reduces the amount of blood pooling in the leg, reduces the pressure in the veins, and reduces the symptoms from the pressure in the veins. And finally, actually, the most important one, is a regular walking and exercise, because regular walking and exercise gets you to use your calf muscle pump, and that pumps blood back up to your heart and reduces your venous pressure. So that's ways of reducing the symptoms of varicose veins, but of high pressure in the veins. But as I said, the only real treatment is unfortunately some form of procedure or surgery.